Hey, it's Dr. DeCubellis. Real quick, I wanted to go over something that I find pretty interesting. I was talking with an attorney the other day about a potential client he wanted me to take a look at, and we were discussing how treatment, typically goes in our office. And one thing that he was kind of unaware of, and I thought was interesting, when we get to a patient and they're done with treatment, I mentioned that we don't release at MMI. And he kind of questioned, he's like, well, why wouldn't you release them at MMI? And I said, because we want to release them under observation. Because while someone may no longer be improving, that means that they don't need any care anymore, which is fine. However, that does not mean that their level right at that point, while they've been getting continuous care and they've been getting active treatment, that is not indicative of what they're actually going to be like stable outside when they have no more treatment. So what we do is we release them under observation for 4 weeks, 6 weeks, 8 weeks, depending on the case, have them come back in. Now we perform a re-exam and we compare what happened on their last visit, which we did a full exam on as well, to this one. Now we can see how stable really are they, and then what are we actually going to find for them going forward? Is their permanency? How is their life affected? And we have a much better way of understanding that because they don't have active treatment going on. And this is more indicative of, again, how they're going to live the rest of their life, because they're not going to be treated 1 time a week, 2 times, whatever it might be. They're not going to be doing that forever. They're going to be living their life. They're going to be working. They're going to be having their household duties, dealing with kids, lifting groceries. We want to see where are they at after they've had that going on for a couple of weeks with no active treatment in the clinic. Now we can talk about permanency, we can talk about loss of life, duties under duress, and we have a much better foundation for it because they weren't under active treatment anymore. So that is really important to me. Why put them at MMI when it actually might be an inflated number or an inflated area they're at because they've had active treatment?